The eye reveals 9 signs of serious diseases that appear in the eyes. Have you ever stopped to think that your eyes may be revealing secrets about serious diseases in your body? What if the answer to health problems you can't even imagine is right in front of your mirror? What would you do if you found out that you could identify life-threatening diseases just by looking at your own eyes? The eyes are not only windows to the soul, but also to your overall health. Medical experts confirm that eye changes can be the first signs of serious conditions that affect other organs. Did you know that more than 70% of systemic diseases have visible symptoms in the eyes? This knowledge can literally save lives, including yours and your loved ones. While many of us overlook small changes in our eyes, these subtle signs may be warning of serious problems. From diabetes to heart disease, brain tumors, and autoimmune diseases, all can leave clues in your eyes. It is no coincidence that ancient Greek physicians already examined the eyes to diagnose diseases more than 2,000 years ago. Let's get started. 1. Yellowish eyes. The deadly secret your liver hides from you. When looking in the mirror, have you ever noticed a yellowish tinge in the whites of your eyes? This is not just an aesthetic detail, but an alarming sign that your liver is in danger. The condition, known medically as jaundice, occurs when there is excess bilirubin in the blood. Bilirubin is a yellow pigment produced during the normal breakdown of red blood cells. A healthy liver processes this substance efficiently, but when there is dysfunction, it accumulates. This buildup then manifests itself visibly in the whites of the eyes, called the sclera. The frightening truth is that this yellowing can indicate everything from viral hepatitis to cirrhosis or even liver cancer. Experts warn that jaundice in the eyes often appears before other more serious symptoms. Recent studies from the University of Michigan show that 60% of patients with liver problems had ocular jaundice as their first symptom. When identified early, this alteration allows medical intervention before liver damage becomes irreversible. The good news is that a simple blood test can confirm the suspicion and direct the appropriate treatment. Ignoring this sign can lead to serious complications, including liver failure and the need for transplantation. Are you paying enough attention to this subtle change that can save your life? Imagine discovering a potentially life-threatening problem with just a close look in the mirror. But what if your eyes are warning you of another equally serious problem? 2 white ring on the cornea. The heart warning that could save your life today. Have you ever noticed a white or grayish ring encircling the cornea of your eyes? This phenomenon, called senile arch or corneal arch, is not just a sign of aging as many think. In fact, when it appears before the age of 45, it represents a serious warning about your cardiovascular health. This ring is formed by the deposit of cholesterol at the edge of the cornea, reflecting what happens inside your arteries. Researchers at the University of Copenhagen found that people with corneal arches have a 66% higher risk of heart attacks. The study followed more than 12,000 people for 3 decades, confirming this alarming association. The scariest thing is that this sign can appear years before a catastrophic cardiac event, giving time for intervention. Cardiologists now include eye observation as part of cardiovascular risk assessment in patients. The corneal arch is directly related to high levels of low-density lipoproteins, the so-called bad cholesterol. This same cholesterol that forms the ring in the cornea also forms plaques in the coronary arteries. The good news is that lifestyle changes and medications can reverse this condition when detected early. Recent studies show that statins not only lower blood cholesterol, but can decrease the prominence of the corneal arch. Many patients report that they never imagined that something visible in their eyes could warn of an impending heart attack. How many lives could be saved if more people knew how to interpret this sign? What if you could prevent a stroke just by paying attention to your eyes? 3. Unequal pupils. Your brain's urgent message that no one told you. Have you ever noticed your pupils at different sizes when looking in the mirror? This condition, called anisocoria, can be normal for some people from birth. However, when it comes on suddenly, it can be an extremely worrisome neurological sign. Neurosurgeons warn that uneven pupils may indicate a developing brain aneurysm. They can also signal brain tumors, strokes, or severe head trauma. Dr. Michael Sabel, a neurosurgeon at the University of Michigan, reports that this is often the first sign of neurological emergencies. The time between noticing this symptom and seeking medical attention can literally be the difference between life and death. Studies by the National Institute of Neurological Disorders show that interventions in the first 6 hours after initial symptoms increase survival by 80%. The brain uses the pupils as an integrated warning system, responding to abnormal pressures or structural damage. Pupillary asymmetry can occur due to compression of the oculomotor nerve by an aneurysm or tumor. Do not confuse this signal with normal variations caused by differences in ambient lighting. A true pathological anisocoria persists even when both eyes are exposed to the same light. Simple tools like the FAST app can help you quickly identify this and other signs of stroke. Neurologist Dr. Rachel Cooper reports cases of patients whose close observation of the pupils saved their lives. What are your eyes trying to tell you right now about your brain? 4. Sudden blurry vision. The emergency alarm. Your body silently goes off. Have you ever experienced a sudden blurring of vision that appeared out of nowhere? This seemingly simple symptom can be an alarm triggered by your body signaling various medical emergencies. Ophthalmologists consider the sudden loss of visual acuity as a symptom that should never be ignored. When only one eye is affected, it may indicate an eye stroke or retinal artery occlusion. If both eyes suddenly blur, uncontrolled hypertension may be to blame. Diabetic patients often experience blurry vision when their glucose levels fluctuate dramatically. The alarming fact is that 35% of patients who suffered strokes ignored previous visual cues. Blurry vision can also be the first sign of multiple sclerosis, according to the National Multiple Sclerosis Association. Optic neuritis, an inflammation of the optic nerve, is often the inaugural symptom of this autoimmune disease. Timing is crucial when it comes to vascular disorders that affect vision. Doctors consider that there is a golden window of approximately 90 minutes to intervene in cases of retinal arterial occlusion. After this period, the damage to the retina can become permanent and irreversible. Dr. Emily Wong, a neuro-ophthalmologist, warns that transient episodes of blurry vision can precede a full-blown stroke. These episodes, known as transient ischemic attacks, act as warnings of what may be coming. Ignoring these warnings can cost you not only your eyesight, but also your life. But do apparently less serious problems also deserve attention? 5. Chronic dry eyes, the invisible threat that destroys your health. Do you consider dry eyes just a minor inconvenience that solves with a few lubricating drops? This common thought may be masking potentially serious systemic conditions that affect your entire body. Chronic dry eye syndrome affects more than 30 million Brazilians, according to the Brazilian Society of Ophthalmology. What many don't know is that this condition can be a telltale sign of serious autoimmune diseases. Rheumatologists now include eye evaluation as an essential part of diagnosing Sjogren's syndrome. This autoimmune disease attacks the tear and saliva-producing glands, causing extreme dryness. The most worrying finding is that 70% of Sjogren's patients develop complications in other organs. Recent studies from Stanford University link chronically dry eyes to a higher risk of rheumatoid arthritis. The connection occurs through shared inflammatory mechanisms between the ocular surface and the joints. Systemic lupus erythematosus also often manifests first through persistent ocular symptoms. Patients with fibromyalgia report that their eye symptoms preceded widespread muscle pain by months or years. Endocrinologists warn that an overactive thyroid can initially manifest itself through dry and irritated eyes. Graves' disease, an autoimmune thyroid condition, often affects the eyes before other symptoms appear. Ignoring persistent dry eyes can delay the diagnosis of treatable conditions, allowing for irreversible damage. Would you be recognizing these signs if they were present in your own eyes? What else can your eyes reveal about the pressure inside them? 6. High eye pressure, the silent thief who steals your vision while you sleep. Did you know that it is possible to lose up to 40% of your vision without noticing any significant change? This is the frightening reality of glaucoma, a disease characterized by high pressure inside the eyes. Glaucoma affects more than 1 million Brazilians, with half of them unaware of their diagnosis. Elevated intraocular pressure silently damages the optic nerve, causing irreversible visual loss. Most worryingly, this pressure often does not cause pain or noticeable symptoms in the early stages. Ophthalmologists call glaucoma the silent thief of vision for exactly this reason. The most shocking fact is that by the time patients notice visual problems, 60% of the optic nerve is already compromised. Researchers at Columbia University have found that glaucoma can also be an early indicator of cardiovascular problems. Recent studies establish a connection between high eye pressure and systemic arterial hypertension. Dr. Sarah Johnson, an ophthalmologist who specializes in glaucoma, emphasizes the importance of annual checkups after the age of 40. A simple measurement of eye pressure during an eye visit can detect the problem before it causes damage. Advanced technologies now allow continuous monitoring of intraocular pressure through special contact lenses. People with a family history of glaucoma have a 9-fold increased risk of developing the condition. The good news is that modern treatments, including eye drops, lasers, and microsurgery, can effectively control eye pressure. But you can't treat what you don't know you have. What if the answer to managing your diabetes was in your eyes? 7 spots on the retina, the diabetic clock that is counting its last minutes. Have you ever imagined that the blood vessels at the back of your eyes can reveal the status of your diabetes? Diabetic retinopathy, characterized by spots and bleeding on the retina, is the leading cause of blindness in adults. This condition affects approximately 60% of diabetics after 20 years of living with the disease. Most alarmingly, these retinal changes often precede complications in other organs. Nephrologists have observed that patients with advanced retinopathy have a 3-fold risk of developing kidney failure. Cardiologists report that the same visible vascular changes in the retina also occur in the coronary arteries. The most striking finding is that the state of your retina can predict heart attacks up to 5 years in advance. Researchers at the National Eye Institute in the United States have developed artificial intelligence algorithms that predict diabetic complications. These algorithms analyze images of the retina and identify patterns invisible to the human eye. Dr. Robert Garcia, an endocrinologist, recommends that every diabetic get a fundus exam at least annually. During the simple and painless examination, the doctor can directly visualize the blood vessels without any invasive procedure. Retinal spots happen when elevated glucose chronically damages small blood vessels. These damaged vessels drain fluids and proteins, forming the stains characteristic of diabetic retinopathy. Early laser treatment can prevent 90% of cases of blindness caused by diabetes. Your eye doctor may be the first to notice that your diabetes is spiraling out of control. And when your eyelids start drooping, what is your nervous system trying to say? 8. Droopy eyelids. The neurological alert that can transform your life in 24 hours. Have you noticed your eyelids drooping more than usual, especially at the end of the day? This condition, called eyelid ptosis, can be much more than a sign of aging or tiredness. Neurologists recognize ptosis as a possible indicator of myasthenia gravis, a neuromuscular autoimmune disease. This disease causes progressive muscle weakness that often manifests itself first on the eyelids. Ptosis can also signal lesions in the third cranial nerve, potentially resulting from brain aneurysms. Brain tumors that compress specific neural pathways often cause ptosis as an initial symptom. Most worryingly, sudden unilateral ptosis can be a sign of an evolving stroke that requires immediate attention. Dr. Thomas Chan, a neurosurgeon at Stanford University, reports cases where ptosis preceded a devastating stroke by days. A distinguishing feature is that neurological ptosis often worsens throughout the day, unlike congenital ptosis. In Horner's syndrome, ptosis is accompanied by a constricted pupil and decreased facial sweating. This syndrome may indicate tumors in the lung, especially carcinomas that affect the sympathetic chain. Recent studies show that 15% of lung cancer patients had ocular symptoms before diagnosis. The good news is that advanced imaging technologies allow for accurate diagnosis of the underlying causes of ptosis. Different patterns of ptosis direct doctors to different types of tests and investigations. A visit to the eye doctor for droopy eyelids can lead to life-saving diagnoses. But what happens when your eyes are constantly red and inflamed? 9. Persistent eye inflammation. Your immune system's desperate cry for help. Do you suffer from red, inflamed, irritated eyes that just don't get better with conventional treatments? This persistent eye inflammation may be the first visible sign of serious systemic autoimmune disorders. Rheumatologists often diagnose rheumatoid arthritis after patients have chronic eye symptoms. Uveitis, inflammation of the middle layer of the eye, is associated with more than 50 different systemic diseases. Approximately 30% of patients with ankylosing spondylitis will develop uveitis at some point. Crohn's disease and ulcerative colitis often cause eye inflammation before bowel symptoms appear. The most surprising finding is that 75% of uveitis is caused by underlying immune disorders. Dr. James Foster, an immunologist, reports that eye inflammation can precede other autoimmune symptoms by up to 5 years. Scleritis, inflammation of the white outer layer of the eye, is strongly associated with vasculitic diseases such as granulomatosis with polyangiitis. These conditions can compromise vital organs such as kidneys and lungs if not treated early. Studies from the Mayo Clinic show that patients with recurrent eye inflammation are 3 times more likely to develop lupus. Episcleritis, inflammation between the conjunctiva and the sclera, is often the first visible sign of psoriatic arthritis. Different patterns of ocular inflammation direct specialists to different diagnostic investigations. Early treatment of underlying autoimmune diseases not only saves vision, but prevents damage to other organs. Your inflamed eyes may be warning you of an immune storm brewing in your body. Now that you know these signs, what will you do with this vital information? Your power to turn knowledge into protection. Now that you know the 9 crucial eye signs, a new responsibility falls on your shoulders. The knowledge you've acquired today isn't just information. It's a powerful tool for protecting your health. Take a moment to check your own eyes in the mirror after finishing this video. Look closely at subtle changes that would have previously gone unnoticed, but that you now know how to interpret. Remember that early detection of health problems often makes all the difference in prognosis. Studies show that people with basic health knowledge live an average of 8 years longer than the general population. The real power lies in the small, daily actions we take to take care of our health and well-being. Don't keep this knowledge to yourself. Share it with your loved ones. A simple conversation about these eye signs can literally save the life of someone you love. Make an appointment with an ophthalmologist for a complete checkup, especially if you have identified any of these signs. Remember that your eyes deserve specialized attention, not only to preserve your vision, but your overall health. Incorporate the habit of watching your eyes regularly, just like brushing your teeth or checking your blood pressure. Mindful self-care is the biggest investment you can make in your future. Modern medicine offers impressive solutions to almost all of the aforementioned conditions when diagnosed early. You now possess the power to be the first to identify important signs that many non-specialist doctors may miss. This active surveillance puts you in control of your health like never before. Imagine how different it would be if everyone had this knowledge that you have just acquired. How many lives would be saved? How much suffering would be avoided with this simple knowledge? Today, you have taken an important step towards becoming a guardian of not only your health, but potentially the health of many. Your eyes are truly windows into your health. Keep them open, not just to see the world, but to see what your body is trying to tell you.